I'm a military brat growing up. So we moved 9 times in 18 years. We never stayed in one place very long. After I graduated from high school, I joined the Navy and went to the Naval Academy in Annapolis, Maryland. When I finished at the Naval Academy and they sent me to Georgetown, women's health just seemed to be something that I was drawn to. And so when I graduated Georgetown, I did an OBGYN residency over in San Diego at the Naval Medical Center there. And when I finished doing OBGYN, then the Navy sent me around the world to different hospitals, like in Japan and rode to Spain and Iceland and places like that. And I just did general OBGYN and delivered thousands of babies and did routine women's health. But at some point, my interest progressed more into cancer, and so I ended up doing general OBGYN for about 10 years, and then the Navy sent me for fellowship at Walter Reed, and at that point I specialized in just cancer, and so I kind of changed my practice over and no longer did labor and delivery and delivering the babies and things like that, and I focused entirely on female cancer. A lot of times patients come in either knowing they have cancer or they come in with a suspicion of cancer. And so they're very apprehensive. They don't know what to expect. What's unique about that for us is it gives us an opportunity to get to know them and hopefully settle them down a little bit in terms of like what the possibilities are and what the outcomes are and what the treatment options are and things like that, and kind of get them to feel more at peace with what's happening. We don't always have the answers right away, but we can certainly help them become more at peace with the idea of what's going on, and then get them in a spot where we can both move forward together in a way that works well for them and helps them feel better about what's happening in their life. When I was at active duty in the Navy, I had some time off, and so I did some locums work or temporary work for Avera. And my experience at Avera was really excellent. And so in the back of my mind, it was always a place that my wife and I thought, well, we could work here one day. Well, my biggest hobby is fishing. I love salmon fishing. I tend to go to Canada a couple times a year up on the West Coast and fish for king salmon. So that's the number one thing that I enjoy doing. I enjoy shooting. Don't get to do an awful lot of that, but I enjoy shooting and I enjoy spending time with my kids. They're growing up fast, and so I don't have as much time left, and so I want to spend as much time with them as I can as well.